Bismillahirrahmanirrahim. My name is Tuba Khurshid and I am from group number 21. Today I will be giving presentation on ventricular arrhythmias. The abnormal rapid heart rhythms that originate in the lower chambers of the heart, that is the ventricle, is called ventricular arrhythmia. It includes ventricular tachycardia and ventricular fibrillation. Both are life-threatening arrhythmias most commonly associated with heart attack or scarring of the heart muscle from previous heart attack. Here is the electrocardiogram showing the premature ventricular contraction. Etiology. In most cases of occasional PVCs, the underlying cause cannot be identified. The premature ventricular contraction that occurs frequently or for a longer period of time are more likely to be related to heart disease, an injury to the heart, or other non-cardiac conditions such as chemical imbalance in the body. Certain medications, alcohol, illegal drugs, and high levels of adrenaline due to stress, exercise, or caffeine also can cause premature ventricular contractions. Now, treatment. For most people, PVCs with an otherwise normal heart won't need treatment. In some cases, if you have heart disease that could lead to more serious rhythm problems, you might need the following, like lifestyle changes or medication. You have to eliminate caffeine or tobacco that are actually most common triggering factors for the PVCs. In medication, we use beta blockers. It can actually suppress premature contraction. Other medications such as calcium channel blockers or anti-arrhythmic drugs such as amiodarone or flecainide also might be used if you have ventricular tachycardia or frequent PVCs that interfere with your heart's function. The case study: 56-year-old woman is admitted to the CCU with the diagnosis of acute anterior wall myocardial infarction. Her vital signs are BP 115 by 75 mmHg, pulse 85 beats per minute. Auscultation of the heart reveals an S3 gallop. Her electrolytes include potassium 3.8 milliequivalent per liter and magnesium 1.4 milliequivalent per liter. Otherwise, her examination is within normal limits. 2 days later, an echocardiogram estimates her ejection fraction to be 35%, which is too much reduced than the normal. During her stay in the CCU and in step-down unit, multiple premature ventricular contractions, that is 15 per minute, were noted on the bedside monitor. No anti-arrhythmic agent was ordered. Now, the SOAP notes. Subjective. Gender female. Age 56. Chief complaint is not mentioned. Current medication, no anti-arrhythmic medication particularly. Objective. Vital signs include blood pressure, which is normal, pulse is also normal, and respiratory rate is 15 beats per minute, which is also normal. Auscultations represent S3 gallop. S3 gallop is basically low frequency brief vibrations, occurs in early diastole at end of rapid diastolic filling period of right or left ventricle. It is also called ventricular gallop. Here it indicates a volume overload. Lab reports: potassium is normal 3.8 milliequivalent per liter, magnesium 1.4 milliequivalent per liter. Ejection fraction is 35%, which is reduced, too much reduced than the normal, which is more than 50%. Ejection fraction basically it compares the amount of blood in the heart to the amount of blood pumped out. It describes how well the heart is pumping blood to the body. And during her stay in the CCU, multiple PVCs were noted on bedside monitor. The assessment: the presence of frequent PVC is a well-described risk factor for sudden cardiac death, and with a low ejection fraction induced by premature ventricular contraction, the risks for sudden cardiac death can increase to 13 folds. Suppressing the premature ventricular contractions under these conditions may reduce the risk of sudden cardiac death. Plan: IV metoprolol 5 mg bolus every 5 minutes, repeated 3 times to deliver 15 mg over 15 minutes, followed by 200 mg per day of oral metoprolol. As acute myocardial infarction and reduced ejection fraction, so it's not a contraindication to beta blocker therapy. Notes: Amiodarone can be considered in high-risk patients with myocardial infarction who are not candidates for beta blocker. And amiodarone is a class 3 antiarrhythmic agent, but also has antiadrenergic class 1 and class 4 activity. Thank you.